Without further ado, please join me in welcoming our presenter for the day, the first woman to present at this UNU-INWEH Scientific Talk, Professor Carmen Logie. Thank you. Professor Logie, over to you.
Thank you so much. You can hear me fine? Okay, great. So yeah, thank you for coming today. I'm really excited to be part of this important series. And let's see, try to progress the slides. Okay, not sure, my slides are not moving. Okay, here we go. So today I'll be talking about three things. First, associations between climate change and extreme weather events and sexual health. Second, case examples that span drought, flooding, vector-borne disease, and wildfire.
Hi, Carmen, can you
on your camera?
Can you turn on?
Can you see me now?
Yes,
Yeah.
Fantastic.
Okay, great. I think I was trying to progress the slides and I accidentally did that. I'm having a bit of challenge progressing slides. I'm not sure why that is. Okay, here we go. All right, so we're going to start at why we're here today. So what is the link between climate change and other extreme weather events and sexual health? Well, it is clear, and I know many of you listening today know that human activities cause global warming, and human-caused climate change affects weather and climate extremes, harming nature and people, particularly the most vulnerable communities. Water, food, and sanitation and security are crises exacerbated by climate change, and water insecurity is the inability to access sufficient, reliable, and safe water for sanitation and well-being. And drought increases food insecurity, migration, and disrupts health services. And water insecurity is widespread. About 2 billion people still do not have safely managed drinking water. Food insecurity is the insufficient and uncertain access to food, inadequate diet quality, and or the inability to acquire sufficient food in socially acceptable ways. And in 2019, 2 billion people experienced hunger or irregular food access. And this recent report by UNICEF notes that 1 billion adolescent girls and young women suffer from undernutrition, and acute hunger impacts more than 276 million people. And sanitation insecurity is insufficient and uncertain access to environments that are safe, hygienic, and private for managing urination, defecation, and menstruation. And sanitation insecurity is also widespread. 673 million people have no toilets at all. And our team recently did a scoping review on climate change and linkages with sexual health that included 83 articles. And sexual health, as defined by the World Health Organization, includes positive, respectful experiences of sexuality and sexual relationships free of coercion, discrimination, and violence. And one of the most commonly examined extreme weather events in relation to sexual health were storms, including hurricanes, typhoons, cyclones, and tropical storms. For instance, hurricanes damaged HIV clinics, disrupted HIV care, and worsened mental health, and were associated with increased intimate partner violence, including in shelters and displaced people's camps. And there's a growing body of research on sexual health and drought. Drought is associated with higher HIV prevalence in contexts such as Lesotho and Southern Africa due to complex pathways, including disrupted education among girls, changes in sexual practices, including transactional sex, which includes sex for food, money, school fees, and other survival needs, and migration. And some researchers have found that drought causes economic harms that elevate risks of child and early marriage. Flooding is linked with damage to clinics and infrastructure, such as roads and bridges, disrupting HIV and other healthcare, and flood-related displacement is associated with increased gender-based violence. And studies have found that extreme heat is linked with increased gender-based violence. including violence in communities and in intimate partnerships, possibly due to frustration and discomfort. Wildfires have also been associated with increased intimate partner violence, and most of this work has been conducted on the bushfires in Australia. So this review led us to conceptualize the multiple pathways from extreme weather events to both HIV and other sexually transmitted infections, or STI, and to gender-based violence through structural impacts, including infrastructure damage, community relationship, and other individual pathways. So our team has been looking at the lived experience of these extreme weather events among young people in climate-affected communities. The first example I will share is on drought, hunger, and extreme heat. Since 2017, we have been working with urban refugee youth in Kampala, Uganda, Africa's largest refugee hosting nation with over 1.5 million refugees. And Kampala's urban refugees largely live in slums and informal settlements in the city. And so Kampala is located in Uganda, in East Africa, and many refugees come from neighboring countries such as the Democratic Republic of Congo and South Sudan. And for several years, our team has documented the ways in which food insecurity is linked with HIV vulnerabilities through transactional sex, and economic insecurity is linked with lower HIV testing. We have also documented that violence, substance use, and poverty co-occur and increase HIV risks, reflecting what is known as a syndemic approach that looks at the synergies between social and health inequities, such as poverty and HIV risk. There's also people who have extended this to talk about ecosyndemics, so the synergies between ecological disruption, social, and health inequities. A recent study we published in AIDS and Behavior revealed that during the pandemic, both food and water insecurity, and water insecurity itself is not often looked at in relationship to sexual health, were both associated with reduced sexual health access, including, for instance, HIV testing, condoms, and contraception, increased transactional sex, and increased unplanned pregnancy with urban refugee youth in Kampala. Among this sample population, a new study also shows that food insecurity and parenthood among youth, this is the same refugee youth cohort, were associated with physical intimate partner violence, and food, water, and housing insecurity and young parenthood were associated with recent sexual intimate partner violence. As climate worsens food and water insecurity and increases heat in contexts such as Uganda, we can only imagine these impacts will become more dire. So since 2019, we've been working in Bidi refugee settlement, one of the world's largest refugee settlements with over 190,000 residents. You can see in this map, Bidi is located at the Ugandan border of South Sudan. And our colleagues recently sent me this photo on WhatsApp describing there is a water crisis with people lining jerry cans up at the water pump for days. When I started working here in 2019, water pumps were open each day and there were people lining up and in crowds to collect water. For the last 2 years, it has looked like this, as the pumps are not turned on every day, so people line up their jerry cans instead. We have written about how, like in other contexts, water insecurity is often linked with long distances to fetch water, long lineups that mean people might go in the middle of the night to avoid waiting in line. And in contexts where women and girls are expected to fetch water, these can raise risks of violence. We actually conducted a post-rape care intervention with refugee youth in Bidi as part of a community-based research study that involved making a comic book from youth stories of violence, where youth shared stories of sexual violence experienced while collecting water and firewood. And today, 3/4 of households in Bidi rely on firewood for fuel. We have a new study in Bidi focused on climate change and extreme weather events with youth. And they also shared how drought leads to extreme heat that in turn results in them sleeping outdoors because there is no electricity for a fan or AC, increasing security concerns. Drought also leads to water insecurity that makes it challenging to manage menstruation. Youth describe that water is one of their biggest challenges. Youth also discussed how drought leads to food insecurity, in turn increasing survival sex, child marriage, and sexual exploitation. For instance, as in this quote from a young person, sexual exploitation for using gardens and land for farming. For instance, one young person said, some girls, they go and ask land from the owners, but they're deceived easily. Like when the owner of the garden decides to say, maybe I'll give you this land if you decide to sleep with me. So they accept, and the owner gives them the garden. And that can also lead to child and early and forced marriage, directly related to a lack of food. In neighboring Kenya, we've also been working with very young adolescents, aged 10 to 14, to understand their experiences of extreme weather events. This involved working with youth in 6 climate-affected regions: Kalabei refugee settlement in the Horn of Africa drought and Turkana region, Kisumu fishing communities, which if you've been watching the news are experiencing a lot of flooding, Naivasha flower farms, Mathare urban slums in Nairobi, which are also experiencing right now a lot of flooding, nomadic pastoralist communities in Isiolo, and farmers in Kilifi. We found similar pathways to sexual health that we found among older refugees in Uganda. Food and water insecurity among very young adolescents in Kenya were associated with transactional sex and sexual exploitation, youth running away, and sexual violence risks. Water and sanitation insecurity resulted in challenges managing menstruation and sexual violence risks using toilets and showers. We also found that without sufficient water, young people aged 10 to 14 could not attend school because they could not wash themselves, they could not wash their uniforms. And without sufficient water, girls in particular were not able to manage menstruation and they missed school. And we know that missing school and not completing school is also a risk factor for early pregnancy and for later HIV acquisition in high prevalence contexts. We spoke to young people about places to access food, water, and toilets that were both stressful and positive using participatory mapping. So you can see here, they like this toilet in the bottom left. It's clean, it has water, there's no long line, and it's cleaned on the weekends. Youth took photographs and walked us around their communities and used emojis to describe how they felt. You can see here the angry red emoji for shared and public toilets that were considered dirty. We then worked on another study, an NFRF study with older youth aged 16 to 24 in Nairobi, including young sex workers who discussed the very specific ways that they were affected by floods, drought, extreme heat, and excess winds. For instance, sex workers on the right-hand side of this picture noted how they were affected by various forms of weather events. So floods could result in a lack of clients and a high risk of HIV because they had less agency to negotiate condom use. Droughts also resulted in a lack of produce to sell and sexual assault risks because of increased stress and poverty. But really, all sexual assault is rooted in gender inequitable norms, not extreme weather events. Extreme weather events exacerbate risks of sexual and gender-based violence, but the ultimate cause of all sexual and gender-based violence is inequitable gender norms. Sex workers described that high temperatures also destroyed food, and excess winds destroyed toilets and venues, and that reduced their ability to access security. And also there might be increased corruptions and exploitation in times of extreme weather events. We also explored how flooding and extreme rain are linked with sexual health in each of these studies. In Bidi Bidi, youth stories help to see the complex pathways from flooding to a range of social and health outcomes. So agricultural destruction and damage to roads led to food insecurity, which led to what was described in both contexts, suffering, people describing their experiences of hunger as suffering, as well as increased theft and security issues, and flooding and heavy rains also leading to housing destruction, which leads to displacement, sanitation destruction, overflowing latrines, challenges managing menstruation, and they also discussed increased mosquitoes and vector-borne diseases. In Kampala, young people described that climate change actually was a driver of youth living on their own to avoid the flooding in slums. And in turn, this could increase HIV vulnerabilities via transactional sex. And flooding really is not very well studied in relationship to HIV prevention. So a young person in Kampala described a lot of adolescents are leaving their families because of climate changes, because of the floods, because of staying in slums. So they start to practice sex work, see how they can live to have good ventilation, or they can sleep well without flooding. And in Nairobi, we heard how in the rainy season, there could be infrastructure damage to roads and houses, and that could increase violence exposure among girls and women. And so an elder in the first quote discussed how in the rainy season, violence was a risk. There were risk factors for violence targeting adolescent girls and young women. So an elder said, when it comes to rape on the side of the girl child, cases are much higher, especially in the rainy season. She goes to school on the other side of the river and gets caught up in the rain. During late hours, she must find shelter and wait. When the rain stops, it can be quite late at night. When trying to make her way across the bridge, she finds heinous guys who abduct her and rape her. It's a great risk to our girls. And this is particularly concerning right now because of all the flooding going on in Kenya. And then a young woman in Nairobi described that her and her siblings were displaced from where they were living in Mathare in the slum because of the rain. And they went to sleep at a neighbor's place, and she was raped at knife point. And in the final example from our 3 cases, climate-related changes were described as increasing vector-borne diseases. And this matters as vector-borne diseases such as malaria are associated with worse health outcomes among people living with HIV, including increased HIV viral load. Similarly, waterborne diseases such as cholera can have particularly harmful effects on people living with HIV. Schistosomiasis, a neglected tropical disease caused by parasitic worms, affects 230 million people globally, and 90% are in Africa. It is shaped by temperature and rainfall patterns, and communities with high prevalence of schistosomiasis also have high HIV prevalence. And female genital schistosomiasis increases risks of HIV infection through causing lesions and affecting the immune system. Among people living with HIV, schistosomiasis is associated with increased HIV viral load, progression to AIDS, and risks of onward transmission. Very young adolescent participants in the Kenya study discussed increased vector-borne diseases such as malaria due to flooding and increased mosquitoes. And we have new studies in Kenya and Tanzania looking at climate change, extreme weather events, schistosomiasis, and HIV risks with adolescent girls. So this is a photo taken by one of the young people, and you can see the quotes that they shared. The grass grows so fast due to so much rain, even mosquitoes end up getting their breeding place. And when people come at night to fetch water, mosquitoes bite them. During rainy season, you'll find a lot of water in the pit latrine and the mosquitoes are breeding in there, and you'll not feel comfortable using it. So you can see these examples. People fetching water might experience a lot of mosquitoes. People using pit latrines will experience a lot of mosquitoes. And yeah, right. So you might be wondering, this is all very interesting, Carmen, but what about Canada, where you're living? So I'll provide the last example about wildfires in the Northwest Territories, or NWT. I've been working for the last 10 years in the Northwest Territories with an amazing Indigenous youth sexual health organization called FOXY, Fostering Open Expression Among Youth, co-founded by the wonderful Dr. Kenneth Liss. And at FOXY, and a parallel program for young men called SMASH, Strengths, Masculinities, and Sexual Health. FOXY is Fostering Open Expression Among Youth. Youth learn about healthy relationships and HIV prevention using arts-based methods, teaching from elders, and land-based retreats at a fly-in lodge. Yet the North is vulnerable to climate change impacts, including increased wildfires from more frequent and intense hot weather, as you can find in the 2022 Chief Public Health Officer of Canada report on mobilizing public health action on climate change in Canada. You can also see reduced ice cover and permafrost degradation are challenges in the north of Canada. And we saw the devastating effects of climate change in the NWT last summer. NWT is warming at 4 times the global rate. Last summer, sorry, was its warmest summer and the 6th warmest year on record. 300 wildfires burned over 10 million acres of land, displacing 2/3 of Northwest Territories population, including my colleagues and friends. We are currently assessing among FOXY and SMASH youth how experiences of the fires and displacement might be associated with mental and sexual health outcomes over time, and are hopefully going to be conducting more in-depth research on this. Fingers crossed for a pending grant. So, where do we go from here? I would like to offer 3 brief considerations. The first is regarding climate justice. The second is concerning climate-informed sexual health. And the third is strength-focused approaches. First, considering climate justice is a way we can envision how climate change and related extreme weather events do not amplify or do not have to amplify social inequities, but the ways we actually respond to climate change and extreme weather events can build a more equal and sustainable world. In this quote, it describes climate justice as prefigurative. It envisions not only a world in which climate change no longer exacerbates social inequity, but one in which societal responses to its impacts themselves offer an opportunity to build a more equitable and sustainable world. Second, for the past 5 years, I've been working as a guideline development group member with the World Health Organization on self-care for sexual and reproductive health. And we are planning on how to tailor sexual and reproductive health care for extreme weather events by using self-care approaches such as self-testing for HIV, long-acting HIV prevention and care, long-acting self-injectable contraception. How can we plan for migration that could be seasonal, it could be affected by extreme weather events, and empower people to better prepare for and manage their health and risks of social harms, such as violence, in the backdrop of worsening climate change. And third, we've heard a lot about challenges today, but as a social worker, I'm always usually being the reminder to look at strengths. How can people live a good life, flourish in the context of climate change and extreme weather events? What does it mean to live a good life? So right now, we're doing work with sex workers and LGBTQ folks living with HIV in the context of extreme weather events and asking them these very questions. Second is disaster resilience. How can we build and conceptualize disaster resilience through leveraging community strengths? So collective resilience, social cohesion. When we asked a lot of the very young adolescents in Kenya about how do they manage and how do they cope in context of drought or in context of flooding, a lot of it was because of people in their community who were helping them. And finally, how can we expand beyond a purely sexual health or a risk focus for health and its negative health outcomes to one, for instance, in the context of sexual health, of sexual well-being, beyond risk and disease. So that includes things such as sexual respect, sexual safety, sexual self-esteem, sexual self-determination. And all of these can be informed by a sex and gender-based analysis that looks at gender norms, gender roles, gender expectations. A lot of people who've been publishing on extreme weather events and sexual and gender-based violence want to remind people that climate change and extreme weather events don't cause violence, gender inequity causes violence. So anything we do to promote disaster resilience, to promote flourishing, to promote sexual or any kind of health outcomes must concurrently focus on gender transformative approaches that address gender inequities and gender inequitable norms that lead to poor social and health outcomes among particularly adolescent girls and young women, but also among LGBTQ folks who are very under-researched in the context of climate change and extreme weather events. And citizen science is another exciting consideration. How can we engage the public, all of us, including youth, in producing knowledge about climate change and how it affects us to influence policy, programs, and science-based decision-making? None of this is easy, but I keep this photo I took years ago as a reminder that change is always possible. And as the Brazilian educator Paulo Freire reminds us, hope might not be enough on its own, but is essential. So this is one of my favorite quotes. I do not mean that because I am hopeful, I attribute to this hope of mine the power to transform reality all by itself. So I set out for the fray without taking account of concrete material data declaring, my hope is enough. No, my hope is necessary, but it is not enough. Alone, it does not win. But without it, my struggle will be weak and wobbly. We need critical hope the way a fish needs unpolluted water. And in closing, we need to better understand across the world in different populations, how is climate change and extreme weather events linked to sexual health? How do existing inequities such as power, gender norms, populations who are criminalized, including sex workers, LGBTQ folks, people who use drugs, how are all of those inequities amplified and exacerbated by the effects of climate change and extreme weather events on sexual health and other health outcomes? And how can we move to a focus on flourishing, self-care, critical hope, citizen science into our work and move beyond silos? And there are so many people, colleagues, students, postdoc teams, research assistants, participants to thank for all of this collaborative work, as well as funders, Canadian Institute of Health Research, Social Sciences, Humanities Research Council of Canada, International Development Research Center, Canada Research Chairs Program. I want to acknowledge Janine Carrington and Petroglyph Comics for the artwork and the graphic design support as well. You can use a QR code for our website at the Shine Lab. And thank you for everybody. Thanks for having me today.
Thank you, Professor Logie.
Turn on the camera.
Thank you, Professor Logie. I wish I'm as excited as when we started, but I can tell you that the impact of the information I had dampened my spirit. But all the same, we'll move into the Q&A. Could you please show the slides with the reports on sanitation and water again? Someone wants to search them up, but wasn't able to take notes of the titles. So can you please do that?
I don't know which slide exactly.
I guess it's at the beginning, the second or third, where you were talking about the statistics, on sanitation, drinking water.
Sure. I have mainly put images on the slides. So maybe it's the reports that they want to look at. I can, I'll try to find that.
That's the person to
window, right?
Okay.
Yeah, I'm not really sure which, yeah, let me see. I'm trying to, I don't know if you can see anymore. Do you see this again? I'm not sure if I'm.
Yes, we can see the QR code.
Okay. Okay. Sanitation statistics, they can look in this report by the UN.
Okay.
Yeah. I did a TEDx talk once and they told me don't put a lot of text on the slides. These are mainly images, but they can probably find it. Going backwards, everybody. Here we are. Yeah. Probably here.
Yeah.
I think that's, you can also look and see if there's more recent ones, but that's,
yes. So I guess Rodrigo can see that now, the undernourished and overlooked, or the state of the world's drinking water, or the state of the world's sanitation. I believe that answers that.
Great.
Before I read another question, what actually dampened my spirit, Professor Carmen, I'll let you know. The fact that the 21st century, 2024 of the 21st century, this is still lived experiences of billions of people. It saddens me. And with the Me Too movement kind of thing going on in America, and putting that in context with this, so water, food is now a weapon. It's been weaponized, for a natural phenomenon that's supposed to be pleasurable. And you hardly even hear this in the public domain. In other words, sexual activities are normally under wrap, something you do in the night or something like that. But that the issue, the basic needs of water or food is now being weaponized and turned into, I hear words like transactional sex over water collection. It's appalling. And I guess what I'm driving at is we need to be able to do more than just rhetoric. What can we really do? Having these serious talks now, what can we really do? It's. Can you please share your thoughts?
I think we need to stop looking at things in silos. So for a long time, there's been research on food insecurity and HIV. But really very little on water insecurity. So I do think having this conversation, having somebody like me be part of your organization who's a social scientist who does HIV research and sexual health research, and really start to just measure these things, to look at them, what to do to change the solution. I think we have to acknowledge that technology on its own won't be our savior. So we can give water to communities, but if we don't address the underlying vulnerabilities rooted in social inequities, there's going to be reproduced inequities. The fact that we need equal investment in the technologies as we do in changing and transforming gender norms. The fact that the only reason I started even thinking about water was in a post-rape care intervention, and thinking this is, something that is so profoundly devastating, that there's so much sexual and gender-based violence in every place in the world, not just here, obviously everywhere. And it doesn't feel like the sectors are talking to each other. So it doesn't feel like, when people building solar lights, why are men going and smashing them? And why aren't men in the communities challenging other men? Like a year ago, I was like, I don't know if I'm still going to be working in refugee camps, because the work that truly needs to be done is gender transformative work by people in the community. And, I don't know what needs to be done, but I do know that I can't just keep documenting suffering without a solution. And I actually don't know what the solution is without a wholehearted community buy-in of transforming gender norms and of men taking responsibility for ending violence towards women. So I think that we need an equal investment in transformative gender work as we do in the technology to address these problems. So that's just me feeling hopeless today, but I think the fact that you're interested in this and that everybody is listening is exciting. So I don't want to be hopeless. I also just say we need to invest in this too.
There was another question.
Thank you, Carmen. I'll come back to my issue. Another question here.
What's the question?
Are the community you worked with supported by civil society organizations? If so, what is their role in supporting them?
Yeah, so I only do community-based research, so I should have mentioned that, but the research being done with the Ministry of Health, so the research in BDBD is with Uganda Refugee and Disaster Management Council. And so research in Kampala with urban refugees is Young African Refugees for Integral Development. And the work in Kenya is with two other civil society organizations called Center for Study of Adolescence, CSA, and Elam Trust. So all of these organizations are trying to run programs and they're collaborating on this research. I think one of the larger issues is that every year I've been going to BD, the World Food Program is getting less and less donations. And so they're cutting the food rations in half. So 2 years ago, they told me they're cutting the refugee food rations in half. And 1 year ago, they said they're cutting in half again. And so civil society organizations don't have sufficient resources to address these really global problems of food insecurity. And water insecurity is, as you all know, you're all experts on this, is extraordinarily complicated to address water insecurity. UN Water is trying to work, in where we work in Calabash and Turkana County, and they've been having the worst drought in 70 years in the Horn of Africa. And so there's really these really massive challenges. So the civil society organizations are trying to do like livelihoods program, and we have a livelihoods program right now in Kampala, and they're trying to do education programs, trying to provide sexual and reproductive health or employment information. So they're trying to do programs. They're not necessarily able to address these larger contexts of food and water insecurity, but they are in communication, and we do have the Ministry of Health on our grants. It's tricky in humanitarian settings because there's a lot of different bodies involved, such as UNHCR, World Food Program, UN Water, so there's a lot of different people involved, and they're supposed to be temporary spaces, even though we know that people end up being in a refugee camp for decades. They're temporary spaces. So yeah, the civil society organizations all have different mandates, but a lot of them are trying to do sexual and gender prevention programming, trying to do youth empowerment, women's empowerment, they're doing great work. And it's hard for them to have sufficient resources to address these really big weather events.
It's okay. Thank you, Professor Carmen. Another question for you here.
To our camera. Oh, it's there. Sorry. So, Carmen, something that I found very interesting, and I think very much in line with my expectations and experience. So, climate change here is just the catalyst. The problem is elsewhere, and even the measures that need to be taken are not necessarily climate related. Right? So whatever you do some of the actions you need to take are beneficial to the fight against climate change or some other things. Now, then what should we deal with this? Shall we continue with the climate narrative? Is it superficial to single out climate change as one of the one of the catalysts only, where in the world that has so many other things, and climate change is just one other catalyst, and sometimes it's not even the most important catalyst. How do we deal with this situation? How do we essentially advise the policy world that climate change is just one of the catalysts, one of the many catalysts, and indeed might not be even the most important one?
Well, because we were focusing on extreme weather events, we did notice that they were really important. So I don't know if this is answering a question. I'm trying to answer a question, but I would say that they are important. But actually, what I was working on even last week was showing that it doesn't matter what extreme weather event it is. It can be drought, it can be flooding. There are these similar mechanistic pathways to sexual health outcomes. So right now, it's absolutely devastating, the floods, in Kenya right now, right? So I do think climate change matters. And I think that with climate change, and there's displacement, but also with drought, there's migration, and those both also lead to food. Drought and flooding both lead to food, water, and sanitation insecurity, and then that in turn increases sexual and gender-based violence. So I actually don't want us to move away from climate change yet in the context where we're working, in the context of Isiolo, nomadic and pastoralist communities. They're some of those deeply impacted by climate change. People, nomadic communities, pastoralist communities. If I could read you some of the quotes, I was writing the paper up last week, and it was just so many people are like, we're suffering, we're suffering, we're suffering, we're hungry, we're hungry. This isn't normal. It didn't used to be like that. And you're correct, not all of it is climate change. Some of it is they saying the army moved in and are siphoning the water from where we used to get water from. But a lot of people are saying because of climate change, the heat has changed in the water, and now we're getting different kinds of diseases with the fish. Because of climate change, there's this new insect, and now it's destroying our maize production. And so people themselves are naming climate change. They're naming it as a cause of the extreme weather events that are causing food, water, and sanitation. So I wouldn't want to move away from climate change yet. I know that there's other issues, we work in context of conflict, but I think that these voices need to be heard. A lot of the climate change research doesn't include very young adolescents in low and middle income countries. They don't include elders. So we talk to elders and the elders in the community, and there's just, and then various remote regions. A lot of people haven't really been talking to these people about their knowledge of climate change. So I'm not willing to go fully away from it. I agree with you. There's a lot of human caused, that people are talking about polluting rivers, people are throwing garbage in rivers, and so there's other issues with water contamination that are more caused by pollution. And we have that in another analysis that we're writing up, but there is still very much, from the perspective of the people that we're working with, discussions of how the seasons and the rains have changed, how the extreme heat, and there was a really great article on how they're actually, I wish I could remember the names of the authors, but if you Google it, humanitarian in refugee camps are built in global regions that are more likely to be experiencing extreme weather events. So a lot of times what happens is they're putting a refugee camp in a place that is more likely to experience drought and extreme heat. And that's very true for Kalobei refugee settlement where we work. It's in the Turkana County, and it's it really was experiencing. I mean, I had young people, when I asked them their recommendations, what should we do about food, water, and sanitation security? They said, can you tell people to stop eating dirt? And I was like, why are people eating dirt? They're like, because they don't have food. And, so I just feel like we can't go away from that yet.
No, that's actually good. And if you're saying people perceive these events as climate change events, that can be a kind of even a motivation to take action. But then when it comes to the action portfolio, the action portfolios that you're proposing can benefit many other issues, right? So it's not only climate change, right? So it's about enabling, establishing liquidity, and so on. Now, when it comes to the action portfolio, actually, if we don't limit ourselves to climate change, then we might be able to encourage more people to take action, because not only this helps with climate resilience, but it's also it has humanitarian values, social value, economic values, and some other things. So that could be the other side of the story. So the motivation can be climate change. The excuse to study can be climate change. But then when it comes to the action phase, we can map and say how this benefits other fights. And this is true about many other things. We say, you hope the farmers do better water management that helps with climate resilience, right? So you don't have, the starting point can be anywhere, but when it comes to policy recommendation, actually, if you have a stronger justification to map, to show that this is helping many other things, and it's not only a climate change thing, because people might also say, hey, like where people are dying of so many other things, climate change is just a future thing that they can't worry about, right? And they can attack. Yeah, but yeah, we can discuss this when it comes to.
No, it's a really good point, because they even call the triple threat in Kenya is adolescent pregnancy, sexual and gender-based violence, and new HIV risks. And in our findings, we note all of those are related to the climate change impacts. So people are literally saying that families are encouraging or telling or getting young women married because their family can't afford to feed them, or girls themselves are getting married because of hunger. So, and they're relating that to climate change. So all of these other larger social issues, and even with boys are missing school and education too. So I think there's different impacts for girls and boys, but boys are afraid of violence. Boys are missing school as well as girls. And then when girls miss school, and they both are running away. And then when you look at the health outcomes and the social outcomes of runaways in low and middle income countries, they're really poor outcomes. So sort of like everybody is winning when you can keep young people in school and educated. It reduces teen pregnancy, it reduces HIV, it has better outcomes for the future of people and societies. So you're right, it's not just one thing, like it actually has all these ripple effects that are really profound.
And one more thing on this, even, and it's relevant to your research as well, in the world that, like, we are having so many debates about the gender and diversity, isn't reducing people, like, humans to boys and girls, isn't that reductionist and against the whole fight for increasing diversity? So profiling people as men, as boys and girls might be counter constructive here.
Yeah, I see where you're coming from, and we're working in countries that criminalize sexual and gender diversity, and where we need parental consent with 10 to 14-year-olds. So for the research on 10 to 14-year-olds and the research in refugee camps, we have simplified it to include cisgender persons. However, with the work for the 16 to 24-year-olds, we have included sexually diverse men, and we've included female sex workers. I have a lot of experience doing LGBTQ research in criminalized contexts. So it just is something that has to be done really carefully, and usually not with children, just because it's so hard to get ethics approval. We have to go through 3 different ethics boards. And so part of it is, part of the reason that we focused on sexually diverse men and sex workers these are 2 groups that are completely overlooked in climate change research. So we have to do this fine balance of when is it more feasible to do gender binary, we're talking to men and women, and then when is it appropriate and we have the correct partners, such as the Center for Study of Adolescence, who has experience working with LGBTQ folks and sex workers, to safely involve folks. And so we're right now doing work in Uganda with sexually diverse folks, but the way that we do it has to prioritize the safety of the participant and the community partner. And so sometimes the way that it's presented publicly doesn't reflect all the other work that is happening in the community level for the sake of us being allowed to operate. So I do think we had a recent study in global mental health on LGBTQ folks in India and Thailand, looking at water insecurity and mental health outcomes. So if folks are interested, we really talked about how LGBTQ folks are understudied in water insecurity work on mental health. And so that was part of a larger LGBTQ study. So part of it is trying to get sexual diversity in a way that we can do the work where it's criminalized. So, I'm a big proponent of decriminalizing people.
No, this was just a question. We have it also, like it's a discussion among, so it's not about your work. It's just the, UN in general also. Like we're dealing with member states
Totally.
also approaching this thing differently. They don't all agree with that sort of, diversity, but then just, a binary identification can be itself a reductionist, and it can be against the fight for recognizing diversity. But yeah, I
No,
know
you're
there
right.
are
I'm going to
other.
add that to limitations in our paper. That's good, because sometimes we do and sometimes we don't. And for instance, after the anti-gay bill passed in Uganda last year, we actually took out our questions on sexual orientation and gender diversity that we had been asking for many years, because the anti-gay bill was so harsh. And our data collectors, who are all Ugandan refugees, were like, why did you take those questions out? And how can we ask the questions in a way that nobody will get in trouble? And so there's a lot of times like needing to be really thoughtful conversations. And sometimes it's, this project was 10 to 14. It's a big one in Kenya that we did. But then the other one was, we did include sexually diverse men. And so I think it's about, like, for me, it's like a puzzle. And so everybody hopefully is adding a piece, and some of the work will be maybe more gender binary work, but maybe include these very young adolescents who are totally understudied, and elders. But then maybe some will be more, like inclusive of sexual diversity, and maybe some gender diversity, and maybe some like sex work. So I feel like it's like, I'm trying to do all the work when it can and when it makes sense that is really intersectional. And also recognizing the context are big barriers to that. But that is something, if they fund us, CHR, for the work in the Northwest Territories, that is actually one of the things we want to really look at, is sexual and gender diversity in experiences of the wildfires and displacement. Like that's like something we're really, really interested in. So hopefully we'll get to do that in Canada.
Good luck.
All right, thank you, Professor Carmen. A few more questions. I know time is against us.
I'll be quicker on this one.
Yeah, somebody is asking, is there any correlation between women representation in management and safer access to water and food in the communities that you work with?
I don't know the answer. I'm not sure.
Good so question. You're not sure
Good
if
question.
Women are actually integrated in water in broader water collection in those communities, or food distribution.
I wouldn't want to say that there's a correlation if I don't know the data. I can tell you, for 2 solid weeks in 2 refugee camps, I didn't meet any other women in any position other than serving me coffee. So everybody in every position that I met, from UNICEF to UNHCR to all of these places, to all the community leaders at both refugee settlements, were all men. Until the point where I was like, I can't take this anymore. I need to meet some women. So I met women refugees who, had extremely challenging stories to tell me. So I personally, but that's like, I don't want to say that's scientific evidence. I personally have noted a lack of women leaders in refugee camps. But there are some women doing excellent work in the health clinic systems. Absolutely. Stigma reduction, gender-based violence, and men too. So I've seen more women in the health space than I've ever seen in the leadership space. So, but that's just my anecdotal. So I don't know. I'm sure somebody has researched that.
Okay.
I have
one more question for you before we go. Miriam is asking, can you please tell us a bit more about what people in Kenya mentioned as their coping strategy, particularly women? The women suffering this, I hope I got the question correctly. Can you just tell us more? How are they coping with this?
I mean, we mainly talk to girls aged 10 to 14 and elders. I'm trying to do strength-based work, and we did ask people, what was joy? How did they find joy in these spaces? Most of the coping was when people said, how do you manage when there's no water? And they said, our neighbors might lend us water, And another coping I do want to recognize is that some elders said that if it was like a young girl was coming late at night to get food, they would send their own sons to walk the girl home to be safe. So there is community care. People do care. And there's a small minority of people, like in every single community, who are perpetrating violence. But there is this sense of like, you know, like I see a young girl, don't walk alone. Somebody walk with her, stay with me, you know, and even neighbors taking in other neighbors. One of the things is just, I want to note that I've learned from 10 to 14-year-olds is that we underestimate them. They know so much. They are so amazing. They have so many great ideas for solutions that they want in their communities. And they're not often treated with dignity and respect. So these 10 to 14-year-olds kept going on about this one person who sold food in the market as being nice to them and not giving them all the rotting food. So we walked to her and we met her and we're like, thank you for treating these young people. A lot of times young people are running around trying to get resources, water, food, and they're not treated well. And it's just, let's don't forget the very young adolescents, because they're really going to be part of our future solutions. So
Okay.
I've been honored to work with them.
That's the last question.
Yeah, thank you. I think another question just popped in. What resonated from this discussion was the ripple effect of climate change on education, which subsequently affects sexual health, you know, and they're saying kudos to you. But to summarize all this, I think what jumps out is the fact that beyond water, food, insecurity, and all the triggers, including climate change, there's an underlying issue, and that is lack of respect for womanhood, you know, and it's all over across the world. I guess that's what we actually need to target, you know, right from some of us who are mothers that have boys, you know, that give birth to boys, you know, to keep educating, re-educating, and changing these practices, that we are all fundamentally humans, Human, you know, first and foremost, before anything else. And somehow, maybe someday, find dignity, you know, in being a woman across the world, and things like sexual issues will not be used as a control to keep dominating or oppressing a fellow human. Professor Carmen,
I agree with you,
so
because
much.
I just want to say that's what the young boys and the elder men were all saying. Like I even wrote that in this, when I wrote the paper up, was they know what's happening to girls and they don't think it's right. So I think that we need to bring them in, all genders, as being part of the solution to what you said about human rights, because it's not that they're not aware. I think that a lot of times they know what's happening and maybe they feel as, you know, what am I supposed to do as everybody? So I agree with you. I think the gender transformative piece is really, really important to bring everybody in, and for human rights, right? So thank you so much.
Yeah.
And one more, and I know you wanted to end it, but one more thing, you mentioned, Carmen, today, and it's very important in a very dark world when we are seeing a lot of ugly things, and we are facing an ugly reality in different parts of the world. Keeping hope alive and innate is also a key, and that's something, you know, that we are responsible for. Seeing all these facts, showing them to the public, but also present, you know, not making them hopeless and killing hope. And let's not forget, once the hope is killed, then no one cares about the environment. No one cares about, you know, the future generations and the future. Then we will function in a survival mode, which would be very, very ugly if we fight over survival.
So on a final note, I guess the message is keep hope alive. Let's keep hoping against hope. Thank you, Professor
And
Carmen.
listen to the young people. Listen to the young people.
Okay, listen to the young people. Thanks so much. It's been very interesting, and thanks so much. I know you've been traveling the world, you know, lately. It's so difficult to get hold of you, but thank you for prioritizing.
Thank you for having me.
Yeah.
And if you want one last thing on hope, when they shared these stories in Isiolo, they built more pit latrines for girls. And when the young people shared the stories in Mathari, the community leaders started an organization to start cleaning the toilets for the young women because of the challenges with menstruation management. So like there is definitely hope. People People want to live in a better world. So thank you so much.
It's okay.
Congratulations to you.
Thank you
Yeah.
so much,
Thank
you know, and thank you
Thanks.
for the work you do. Take care.
Thank you. Bye.
From us, UNU-INWEH Science Talk for today. See you next week. Bye.